Okay, excuse me. So, what I wanted to talk about today is IFAKs, your individual first aid kit. I want to talk about what it is, I want to talk about what it isn't, and I want to talk about the things that should be inside of it and when you need to use those things and when you don't need to use those things. So, indications and contraindications of when to use the things that are in your first aid kit. So first off, what is your IFAK? Your IFAK is the medical supplies that you keep for yourself to mitigate life-threatening injuries. I think that's a big key takeaway is life-threatening injuries. You don't use your IFAK for scrapes and boo-boos or anything that is non-life-threatening. Now, for the most part, unless you get into some higher level stuff, all of your IFAK supplies are going to be from a BLS, basic life support standpoint. Really the only ALS intervention that should be, or that could be in an IFAK is your needle decompression, your needle catheter. So all of these skills and all these tools and equipment that are in your IFAK can be easily mastered really by anybody, and they should be. You know, if you are doing the things that we like to do, you should have a good IFAK. Okay, so that's what an IFAK is. What is not an IFAK? As great as these things are from AustereMedicine Consultants, love these guys, these things are not an IFAK. You can't put these things in your kit and say, I have an IFAK. While they are phenomenal pieces of equipment to have, and I think everybody should have the over-the-counter, the minor incident, and the thermal injury kit, they're not IFAKs. These things are not going to treat your life-threatening injuries. These are the great things to keep in your rucksack. These are the great things to keep in your footlocker or in your car, in your medicine cabinet. Probably not in your medicine cabinet because you should have a nice home medical kit like I have. But anyway, these are your field boo-boo kits. I got burned by my suppressor. I cut my finger with my pocket knife. I am having severe allergies, right? That's what these things are for. Not, I have an arterial bleed. I have 18% burns on my body. I am going into anaphylactic shock, right? These things don't treat your life-threatening injuries. So these are not an IFAK, but I think you should still have them. Your little first aid kit, your backpacking, hiking first aid kit that you buy at REI. Like for instance, this stuff's right here, stops bleeding fast. I hate to say it, but this bandage is not going to stop an arterial bleed. Okay? So again, while these are good for, your minor injuries, they are not your life-threatening injury, care. So that's what an IFAK is. That's what an IFAK isn't. So let's talk about what goes into a good IFAK. All right. So what goes into an IFAK? You need to have a compression bandage, you need to have some compact gauze, you need to have a nasal airway, and you need to have a chest seal at a minimum, okay? You can get into, I think I have it in this one. Yes. Oh man, I'm gonna draw a permanent marker on my new couch. Don't do that. Okay. You can add in a Sharpie and a needle decompression in there, and you should also have at least one tourniquet. I should move all that shit out of the way, okay? So this is pretty much your standard IFAK contents. Even throw in some scissors. How about that? We're really getting into it now, okay? So what you should have is scissors, good trauma shears. These are cheap. You should have a Sharpie. Needle is kind of ancillary. You should have at least one tourniquet. a nasal pharyngeal airway, an MPA. People are going to say, well, what size should I get? Your typical adult males are going to be between a size between a 24 to a 28 size nasal airway. Okay? 24, 26, 28, 30 if you got a really, really big nose, big dude. But those are going to be probably your most common size for an adult male. Okay? Chest seals. Some chest seals come with one, some chest seals come with two. But you can also use the packaging as well, and we'll talk about that in a second. Compressed gauze. So you can get combat gauze, which has the anticoagulant impregnated in the gauze, or you can just get plain old compressed gauze. One, yes, is going to be a little bit better than just plain compressed gauze, but the function of what the compressed gauze do pretty much is the same. And then your good old-fashioned Israeli bandage emergency trauma dressing. Okay, this is great. They're not expensive, but if you are weird and you can't afford, a $12 or even a $5, I don't even know how much they are now, somebody correct me. If you can't afford this, then you can get a bunch of gauze and an ACE wrap, and you're essentially doing the exact same thing. You get one of those big absorbent pads and an ACE wrap, and you get yourself a compression bandage. But this is just like a pre-made one, okay? All right, so those are the items that go into your IFAK. So now let's talk about when you need to use these things and when you don't need to use these things. Okay, when to use your tourniquet. You use a tourniquet for arterial bleeds from an extremity. Okay, an extremity is your legs and your arms. Okay, most battlefield injuries happen, or most battlefield deaths occurred from traumatic bleeding, uncontrolled arterial traumatic bleeding from an extremity. So that's why we started using tourniquets. Okay, that's when you use a tourniquet, is uncontrolled arterial bleeding from an extremity, or really uncontrolled bleeding, because you can bleed out not from an arterial injury, but like uncontrolled bleeding. If you can't stop bleeding, you use a tourniquet. So when is a tourniquet the first thing that you use? If you are providing care under fire, you are in a shootout and you see that one of your buddies has been shot or has some sort of uncontrolled bleeding from an unknown area on his extremity, and you are providing care under fire, that is when you would put on your tourniquet in a hasty fashion. You put it high and tight on the extremity, and you twist the windlass until the bleeding stops. That is when you use a tourniquet without really exposing or figuring out what the injury is. Just care under fire, you slap that tourniquet on, and then you begin your casualty evacuation. When you don't put a tourniquet high and tight, if you are not providing care under fire and you are not in any sort of life-threatening situation based off of your environment, first you would want to expose the injury, find out where the person is bleeding. That's where trauma shears come in. Cut off all of the fabric, all the clothing away from where the injury site is, expose the injury, and figure out where they're bleeding from. If they're having massive uncontrolled bleeding and you can expose the injury, you do not put the tourniquet high and tight on the extremity. The tourniquet would then go 2 to 3 inches above the injury site. Okay? 2 to 3 inches above the injury site after you've exposed the wound. Now, in some medical book, I'm sure it'll say apply direct pressure to the wound, and if the bleeding doesn't stop, then apply a tourniquet. It's kind of like your escalation of care, the escalation of interventions. You want to start with the least invasive intervention and then work your way to the most invasive. So, you could, if you really wanted to, if you weren't sure, you could apply a pressure bandage to the wound, and if the bleeding still doesn't stop, then you can then apply your tourniquet 2 to 3 inches above the injury site. But if you're panicking and you don't know whether to do the pressure bandage or not, then it is a safe bet to place that tourniquet 2 to 3 inches above the injury site. Be sure when you apply a tourniquet that you mark down the time that you applied that tourniquet, because that is going to be vital information for your definitive care to know, so that way they can apply proper medication to mitigate any sort of compartment syndrome. So always carry a Sharpie, so that way you can write down the time. If you don't have the time, or if you don't have a Sharpie, then you can write in their blood on their forehead T, and then write down the time that you administered that tourniquet on their forehead. Okay, so that's using a tourniquet. If you're providing care under fire, you see that your friend is bleeding from an extremity, you can place that tourniquet high and tight, up on the shoulder, or up high on the thigh, to stop that arterial bleed, and then you would evacuate your patient, and then go into your regular field care, where you are exposing that injury and doing a full trauma assessment. If you are not in any sort of life-threatening situation, you expose the injury first, and then you would apply the tourniquet 2 to 3 inches above the injury site. All right, so that's that. When do you use your emergency trauma bandage? This is going to be for any large bleeds or large wound sites that are not producing that bright red blood, and the blood is not flowing out. It's just a big injury, it's a big cut that you can apply a trauma dressing. So essentially it's one step below when you would need a tourniquet. Okay. Now the pressure bandage can act similarly to a tourniquet, to where you can tighten that pressure bandage and get that pressure bar down on top of the wound so tight that it does severely restrict blood flow. Generally, that's something that you should want to avoid, is restricting blood flow. You just want to stop the bleeding at the site. All right, when you use your compressed gauze. Compressed gauze are going to be used to treat penetrating injuries, open penetrating injuries that are not in the chest or abdominal area. Okay? You do not put anything inside of your abdomen. Nothing goes inside of your abdomen. You don't stuff gauze inside the abdomen, nothing. Okay? If you have a large abdominal wound, you simply want to cover that and wrap it tight. Okay? You don't put anything, if somebody's eviscerated and their intestines are hanging out, don't try to put the intestines back in, because you can really, really fuck somebody's life up that way. Okay? So don't do that. But you use compressed gauze for penetrating open injuries. If somebody's stabbed with a knife, don't pull the knife out and then put compressed gauze in there. Okay? Don't put compressed gauze around an impalement. Okay? Don't try to pack around where the impalement is. Okay? This is for an open penetrating wound. These are going to be best used for junctions. Okay? So your shoulders, your hips, your neck, anywhere where you can't tourniquet is going to be an ideal spot where you'd want to use compressed gauze. And the idea is that you want to push and force gauze into the cavity so firmly that inside the cavity creates enough pressure that it stops the bleeding on the inside. Okay, so it's essentially like a pressure dressing, but from within the wound itself. Okay. And you want to press and push and push and push as much as you can. And then once you have all the gauze that you can fit inside of that wound, then you put the rest of the gauze on top of the wound, and then from there you can apply your bandage. Okay. These aren't really used. I mean, I guess you can use them pretty much however you want. But ideally, these wouldn't be used to wrap around what am I trying to say here? They wouldn't be used to like act as a wrap. You're not going to wrap somebody's wound with this. This is going to be for packing, okay? When you don't use this for abdominal wounds or chest wounds. All right, so speaking about chest wounds, we have our chest seals. Okay. This one's a little messed up. All right, chest seals. What I tell people is you tourniquet extremities, you pack junctions, and you seal chest wounds. Okay. Why do we seal? Well, I think we should all know now that chest cavity, the expansion and contraction of your lungs has a lot to do with the internal pressure of the pleural space in your diaphragm in your lungs and all that jazz, right? When you fuck with that pressure is when you get into your difficulty breathing. When you do not need a chest seal. If there is no penetrating trauma to the chest that is affecting the internal pressure of your chest, you do not need a chest seal, okay? So if you have somebody who, let's say, I don't want to say got shot because that's too easy. Let's say somebody was riding their four-wheeler and they snagged a branch and it kind of nicked them in their chest, okay? And you get there and you look at them and they're, they're bleeding a lot. And you look at the wound, but it's not a penetrating wound. It's not deep inside. It's not affected that pleural space. And they're not experiencing any sort of severe difficulty breathing. You do not need to apply a chest seal because that pleural space in that internal pressure chamber that is your thoracic cavity has not been affected. Okay. How do you know if their chest cavity has been affected? If they do have a penetrating wound into the pleural space? Well, you can see bubbling of blood at the injury site. If you see bubbling of blood at the injury site, you know that air is now entering and escaping through that injury site. That is when you would need a chest seal to repatch that pressure chamber in your chest. You can also have, I guess it wouldn't be an open injury because a flail chest that's already punctured your pleural space through broken ribs, that wouldn't need a chest seal because there's no open penetrating wound. That would be an internal penetrating wound. So chest seals wouldn't happen there. You just need a rapid transport for that. Okay, so penetrating trauma to the chest that has affected the pleural space of your chest, you need a chest seal. If it hasn't, then you don't need a chest seal. Okay, nasal airway. When do you insert a nasopharyngeal airway into your patient? If they are unconscious or if they are unable to maintain their own airway. Okay, so if you have a patient who is semi-conscious that cannot maintain their own airway and their tongue keeps falling into the back of their throat, then you would need to insert your nasopharyngeal airway. If your patient is completely unconscious, then they definitely can't maintain their own airway. Then you would need to insert the nasopharyngeal airway. When you do not insert the nasopharyngeal airway is if your patient has facial trauma to the maximal. All of the bone structure that's in your teeth, your cheekbones, your nose, your forehead, your eye sockets, you do not put a nasal airway into that patient because you risk poking the brain of your patient when you slide this into the back of their nose. That is when you need an oral pharyngeal airway, which if you carry, great, which if you don't, it's not that really big of a deal. But that is when you do not insert a nasopharyngeal airway, is if they have massive facial trauma. Okay. When you use your needle catheter, if you if your patient is showing signs of a intention pneumothorax, severe difficulty breathing, decreased lung sounds when auscultated using your stethoscope, jugular vein distension, and tracheal deviation. Tracheal deviation and JVD are usually going to be your late symptoms, your late signs of a tension pneumothorax. And at that point, your patient's very close to being fucked. So it's going to be your difficulty breathing and your decreased lung sounds. So be wary of when to use your needle D. You have to know exactly where to use it. There's 2 spots where you can use it. I'm not going to talk about those spots because you should go and get professionally trained on that. A lot of people say, well, I don't know how to use it, but I'm going to carry it because somebody might know how to use it. Yeah, that's cool. Like if you want to like cosplay as your favorite, soldier who carries the needle D around and CLS trained and all that shit. But like, if somebody stabs this into you and they put it in the wrong spot, it can really fuck your day up. This is a lot of people would say this is a pretty normal intervention, especially on the military side. But like for civilians, this can really jam you up if you don't know what you're doing. There's a lot of nerve bundles and stuff in and around the heart that can really mess you up. So anyway, I would just say be cautious with your needle D. Is that it? That can't be it. I guess we can talk about different ways to set up your IFAK. Yeah, let's do that. Okay. All right. The first way is pretty common. It's on the back of you put it on the back of your battle belt. This is a knockoff T-Rex arms rig thing. But it sits on the lower back of your battle belt. You got a spot for a tourniquet up here. And then inside you have this like caddy. All right. In this caddy, I have some extra medical gloves. I have 2 compressed gauze. If I can pull these out. There we go. 2 compressed gauze. I got an emergency trauma dressing. The NAR Mini 4-inch ETD. And then I also keep my chest seals in here, which are probably getting close to being expired actually. I'm sure they are. Anyway, and then I also keep a needle D in there, as well as my Sharpie, and they live up in here like this. All right, so that's one way. You can't always wear a battle belt, because if you're carrying a rucksack, it gets really uncomfortable. So, if you can't wear a battle belt, move all this shit out of the way. Then you can put it in a fanny pack. But what I like is this setup right here. Okay, put this like this. This setup fits in like a smoke grenade pouch. And you just leave the handle in there and you can open up your pouch and pull it right out. I think this is extremely convenient. This opens up, and what you have here is a trauma dressing. You have a chest seal. You have your nasal airway, you got a needle D, and you got a compressed gauze up here. And I just got some Velcro wrap right here, just to kind of keep everything tighter, but it also holds the shears in there. Okay, I think this is one of the best ways to carry an IFAK because it just sits in a small, narrow pouch, and you can easily grab it with this big handle right here. I like that a lot. What I also like a lot is, I forget the name of the company that came up with these, like, rolled IFAKs. Somebody's going to get it to me. I have the knockoff version of it. But what that is it sits on my chest rig down in here. Okay? And I've already went through this one of what I have in here. I have these items in it. Okay? And then I keep the tourniquet on the inside pouch up in here. So I like that a lot. I think it's very convenient and it works. Okay. Then we have, get this out of the way. What I have in my plate carrier on the front plate, behind the front plate, is this pull-out that I made. I did a Instagram post about this. Essentially what I did is I took the contents of an IFAK and I put it inside of a vacuum sealed bag, laid it as flat as I could, and sucked the air out of it. Okay. What I have in here, up top is a chest seal. This stuff right here is gecko tape. It's like North American Rescue super sticky adhesive tape. I have 2 compressed bandages. I have a nasal pharyngeal airway. But what I did with the nasal airway is inside of the nasal is a loop, or is a bit of 550 cord. So that way the tube doesn't become collapsed and stay collapsed. Even though it's, vacuum sealed, it's still keeping a void so that way you can still get air in. I have some gloves, and then this is a trauma dressing that I've taken out of the pack and laid more flat, so that way it sits flatter inside the vacuum seal pack. And then I put a duct tape pull tab on it, and then in the corners I already pre-cut some tearaway spots, and I painted them red so that we can just tear it open and then the contents come out. So yeah, that's what this is, and it just lives right on the inside of my plate carrier. So even if I don't have my battle belt on me, or my my pouch IFAK isn't on me, I still have an IFAK. Now, you might be saying, well, hey man, that's gonna be really hard to get if you're providing care under fire. Maybe, but again, the IFAK is not really for you to use on yourself, it's for your buddy to come and use on you. If you can use it on yourself, great. But like, frankly, if you're gonna be providing care to yourself, you might be pretty fucked up to the point where you can't quite help yourself beyond putting a tourniquet on yourself, okay? But like, if you're gonna do the sub, just make it very clear to your friends and your family that my IFAK is inside of my plate carry behind my front plate. So that way they can come up under your thing, rip this open, grab this, and pull it out, okay? So, that is all I got. One last plug for Austere Medicine Consultants. Go and get their kits right here, your minor incident, your over-the-counter, and your thermal injury kits. Get 2 sets of them, get 3 sets of them, put them everywhere. They are awesome. So you can go to Canaan Provisions to get them. You can go to their website and get them. I'm sure some other people are starting to sell them. But I'm not affiliated with them in any way. I just really like their stuff. So, and I like their mission. So go forth and get their shit. And that's all I got. Thanks for sitting down with me. Take care.